To your health, specifically type 2 diabetes. A recent study talked about the impact of weight loss surgery helping patients possibly more than intense medical therapy.
Today, Dr. John Schramm, a bariatric surgeon from the Spectrum Health Medical Group, is here along with one of his patients, Betsy Ulicki. And Dr. Schramm, let's start out by talking about really this study, which seems so groundbreaking, just the real advantages to people who have type 2 diabetes.
Yeah, the study that was published in the New England Journal of Medicine last month, a study that was done at the Cleveland Clinic, where they had 150 patients who had long-standing type 2 diabetes, and they randomized 52, the best medical therapy available at the Cleveland Clinic, 52 to gastric bypass surgery, and 52 gastric sleeve surgery. And what they found over the course of a year was that the 50 patients who underwent medical therapy, they were able to get some modest improvements in their diabetes. But in half the people who underwent bariatric surgery, they were able to get a complete remission of their diabetes off all medications and normalizing of the hemoglobin A1C. So diabetes was gone.
Okay.
And just an amazing result. For the first time in a randomized study, we were able to document that surgery was just tremendously effective in treating a very difficult to treat disease.
Yeah, and Betsy, you're a patient of Dr. Schramm. Why don't you start by telling us when you were diagnosed with diabetes and you underwent this surgery in January, a little bit of your history and coming up to today.
Sure. I was diagnosed my first year in college when I was 18. I ended up in the emergency room and they said, you know, how long have you been diabetic? And I said, what do you mean? And they're like, well, you're diabetic. Wow. So I started that process. I went to all the nutrition classes and things like that. And just over the years, it just kind of progressively got worse. I was on pills for a while, and then I went to insulin, and then eventually I had an insulin pump. And with my insulin pump, I was taking upwards of 250 or more, sometimes units a day of insulin. So like anytime I was eating anything, I was just taking massive amounts of insulin, and it just, my blood sugars were kind of out of control. They were like near 300 all the time, and that's when you start doing damage to your organs and things like that. So I just become really frustrated with being diabetic and trying different things and feeling like it wasn't working. So I knew someone that had seen Dr. Schramm, and they actually had a different procedure than I did. But when I went and met with him, he said, you know, I want to talk to you about this gastric sleeve surgery and what it's doing for people with diabetes. And it was like instantly like, wow, I'm so excited to try this. So I had surgery in January, and since then I've lost 60 pounds, and I'm totally off insulin. And I take a pill now once a day, and they don't know if I'll do that forever, if this is just, they're trying kind of trial and error now to see what I'm going to have to deal with.
That is just remarkable. Dr. Schramm, is it, what is it about the body that has these changes? Does the body change in how it metabolizes food?
You know, we used to think that maybe it was just all about the weight loss that really affected the diabetes, but we know now that because Betsy's insulin requirements were way, way less even before she lost much weight. And we know now that there's involvement with what we do. What we do now is more like metabolic surgery. We're changing the way with the gut hormones. We're changing the way that the inflammatory cycle occurs in the cells. And because of that, we're actually seeing a difference in the way that the insulin receptors work. And so that the insulin receptors in the cells are more active, more receptive. So we're changing the way the body's metabolic process works. Wow. So we actually think of this now more as a metabolic operation than just a weight loss operation.
I've never heard anybody say that they've been cured of diabetes, but certainly in hearing Betsy's story, it really seems like this is almost a cure. People are just managing it. That's what she had done for many years. So this seems like just such a breakthrough. It
really is. I mean, what was amazing in that study that was done at the Cleveland Clinic, in half the patients, they were off all medications and had normal hemoglobin A1C. So if you define diabetes as having an elevated blood glucose level or hemoglobin A1C, these people were cured.
Is this just for type 2 diabetes?
Correct.
Okay.
Type 1 diabetes is a different disease.
Completely.
The insulin just isn't producing, or the pancreas isn't producing enough insulin.
Okay, so we're talking about people with the type 2 diabetes, and there are so many people who suffer from this. I mean, what a life-changing experience for you now, Betsy.
1 in 8 people in the state of Michigan suffer from type 2 diabetes.
That's a lot of people. And Betsy, what are you able to do now? You know, we know that the medications that you're taking have changed, but on the other physical side and other different aspects of your life, how is that different than life, let's say, a year ago?
Sure. Well, I think when you're diabetic and your blood sugars are high a lot, you just don't feel well, you don't have any energy. So I've just noticed things like I'm excited to go do activities again. Even just playing with my kids before, I'd be like, oh, go play outside, now watch you out the window. And now it's like, let's all go play outside, and I'll go push you while you swing, and just things like that you don't even realize you were taking yourself out of. Having the energy to do that again, or just, even the fun stuff like going shopping. It's fun again. It's not depressing. I don't leave crying out of the dressing room. Just things like that have been a huge lifestyle change. And the way our family eats, I pay more attention to what my kids are eating and how much of things they're eating, where before, I thought maybe I did, but now I really notice, and we really try to be a lot healthier with our family and just be more active as a whole family. So it's not only benefited me, it's benefited my whole family.
So Dr. Schramm, where are we at with this now? We've had this great study published. We have people like Betsy coming forward with her great results. Do you find that there's now more interest and more of a willingness for people to step forward and go through a procedure, and for insurance companies to pay for it?
We've seen a tremendous response from insurance companies, and insurance companies are much more willing. I mean, this is a cost savings.
Yeah, I was going to say, eventually it's going to have to.
Diabetes is very expensive to treat, and so if we can, lower costs for treating patients, so insurance companies are changing. They're lowering the limits as to when you can have weight loss surgery, bariatric surgery. So they're making it much easier for patients to go through this process. And I think more it's really about education. I think people need to understand that we're not talking about just weight loss surgery. We're talking about metabolic surgery. We're talking about the ability to have an impact on diabetes, hypertension, hyperlipidemia, hypercholesterolemia, those real problem areas that lead to coronary disease and life shortening.
Yeah, seems like it's just the tip of the iceberg.
It really is.
And you're opening a lot of opportunities by offering seminars to people who want to learn more. They take place on Wednesdays and Thursdays, and so this is very exciting for people to be able to talk about their situations, their possibilities. You do have to call to register. We've got a couple numbers on our screen. We're going to put them online also, or you can go online. There's the address, and so you're just looking for people to come out and get the information that's out there.
Happy to help make people healthier.
Yeah, absolutely. How exciting. Thank you both for being here with us today.
Thanks for having us.
Congratulations.
Thank you.
Thanks.
Awesome.
We'll be right back.